All right. Well, here
Cool.
we go. I want to welcome everyone to our Q&A session this afternoon with uh, we have with us Ansel from Be Well, New Mexico, and I'm grateful that he's not wearing a Tennessee Titans shirt since I've got my Bronco shirt on. But Ansel, welcome this afternoon, and tell us a little bit about yourself first off.
Yeah, well, thank you so much for having me, Carl. So my name is Ansel Lane. I'm the Small Business Outreach Director with BeWellNM. That's the New Mexico Health Insurance Exchange. I'm super excited to be here. I'm really grateful to Carl for having me on here. I know that you guys have a lot of stuff going on, and obviously it's kind of a crazy time with everything going on. So I'm really, I'm happy y'all made some time for me to come on here and talk about BeWellNM. I certainly appreciate it. I've been with BeWellNM almost a year now. It's been great. Prior to COVID, I was traveling around the entire state doing small business presentations and seminars, talking to folks from, Las Cruces, Alamogordo, Silver City, all the way up to Santa Fe and Raton. So I had done presentations in 11 out of 33 counties before COVID shut everything down. So just trying to catch up some lost ground here and, let folks all around the state know about BeWellNM and kind of what is going on. Because a lot of people, either have misconceptions or don't know about what we actually do. So I'm just trying to spread the word and do it the best that I possibly can. So again, thank you so much for having me here. I really appreciate it, Carl.
Well, you can only work from home so long and watch so many cat videos before you have to get back to something productive, and it looks like this might be a good way to do it. Be Well New Mexico is a chamber member, and they've been a chamber member through all the iterations, leading up to the Affordable Care Act and on to its present form. Tell us what is BeWellNM and exactly, explain what the organization is and how you work.
Yeah, no, that's a really good question, Carl. Like I said, there's a lot of misunderstandings about kind of what BeWellNM is. So BeWellNM is the New Mexico Health Insurance Exchange. Essentially, just the most basic I can say it is we are the marketplace where New Mexicans can shop, compare, and buy the plan that's right for them by making apples to apples comparisons between affordable health plans. So essentially, we are where New Mexicans, whether they're an individual, a single person, a family, or a small business owner, where they can go and find the right health plan for their situation and make the right comparisons, figure out what's going to be best for them. Really our main goal, our mission is we're trying to bring health insurance options to every single New Mexican in need, sort of regardless of where they stand economically, whatever their situation may be. We want to make sure we're getting the plan to them.
Yeah. Uh, Tell us what are your missions and goals with Be Well?
Yeah, so I guess kind of like I was saying, we're really trying to make sure that every New Mexican has, options as far as health insurance goes. A lot of folks, they're not really sure what's going on out there, what options are available to them. So we've partnered with Medicaid and the New Mexico Medical Insurance Pool to make sure that everyone, like I said, regardless of income level, can get the health care that they need during such a crazy time. There's subsidies available for those who qualify. And for those who are kind of on the fence about, I'm not sure if I qualify or not, I'm not sure if this is going to be worth it, don't gamble with, your health insurance. Don't gamble with something that's this important. Talk to a broker, see what you qualify for. If coronavirus, the COVID-19 pandemic has taught us anything, it's that our health is the most important thing. So seriously, folks, if you're on the fence, you're not really sure what you're going to be able to get, as far as, subsidies or help paying for insurance, just apply, just see what the situation is. It's completely free. They're not going to take down your information. They're not going to hound you with, with calls trying to get you to sign up for anything. Just talk to a broker and figure out what you're going to be eligible for as far as cost savings, because there are a lot of options out there for New Mexicans who are, kind of on the fence if they're able to afford it or not. So just want to let folks know at home that there are options regardless of whatever income level you might be in. We do have options for you.
All right. And obviously, speaking from the chamber's perspective, we're serving businesses and we're talking about businesses. Tell me now, you've got options for businesses. Do you have options for individuals and families as well, even if they're not, if they don't have a business?
Yeah, absolutely. So BeWellNM really started for families and individuals, and as kind of we're really coming to the forefront as far as businesses go as well. So I guess to answer your question, BeWellNM is for all of the above, for families, individuals, and businesses. We have healthcare options for everybody, every situation that you might be in. We have an open enrollment period coming up, which is going to be able to help folks get the plan they want for 2021. There are a lot of different options when it comes to families and individuals and businesses. For instance, families and individuals are going to have to wait for open enrollment or sign up through a special enrollment period, where businesses, they can kind of get people enrolled throughout the year, so you don't have to wait for that special enrollment period. Businesses kind of they act as a lifeline between employees and getting insurance. A lot of times, Carl, we find folks are kind of stuck between a rock and a hard place when it actually comes to health insurance. They're working full time, but they make too much to be able to get Medicaid or a heavily subsidized government plan. But they don't actually quite make enough to be able to afford the insurance outright. I know health insurance it's really expensive. So this is kind of where small businesses can step in and help. Small businesses can be that lifeline to offering, a second path to insurance. So they can offer a group plan at no out-of-pocket cost to the business itself. So offering a group plan typically will lower the cost as opposed to going, into the individual marketplace on your own. So they can offer potentially a lower cost alternative for their employees to get health insurance without any out-of-pocket cost to the business. So really, businesses are in a very unique position to be able to offer insurance to their employees, creating a huge benefit, and it doesn't really cost the business anything.
Yeah, I had a member email me a question about they're getting health insurance through their wife's plan, and she's a governmental plan, and she's retiring, and he's going to be looking for an affordable option, even though she'll still have affordable coverage. Is that something that I mean, what are the chances of someone like that finding a good option?
Oh yeah, great. So obviously they're going to want to talk to a broker. We have a huge network of agents and brokers all throughout the state that can really specifically answer each question. But yeah, I would imagine that situation for that family there, they would be able to find some good low-cost health alternatives through BeWellNM, either through the individual or family marketplace, and potentially through his business as well, just depending on what's going on.
Yeah,
I know that some governments positions, their benefits extend past the point of retirement. I don't know if that's the situation here, but there are a lot of good options that are very flexible, especially when it comes to small business. So say, he had a small operation, with him and his wife and maybe a couple other employees that are part-time. That would really would be a great way for them to go, but without talking to them, personally and knowing their situation, I can't get, too specific with everything, but that's where folks are going to want to talk to a broker.
he was looking at a sole proprietor, and so sole proprietor would be something that would work real well.
So sole proprietorship is a little bit different because you need to have at least two full-time equivalent employees. So you could have 4 employees whose hours add up to 2 full-time employees, but 2 full-time equivalent employees that aren't the owner and their spouse. So say it's a sole proprietorship, it's just the owner and maybe his wife helping out. They would not be able to qualify for the small business insurance. They'd want to go through the individual marketplace, but there still are a bunch of subsidies available for people in that situation.
Okay.
And again, that's based on marital status, income, etc. So again, the best way to find the best plan for you is going to be to go through a broker. And on our website, BeWellNM.com, again, BeWellNM.com, there is a really handy find a broker tool. So if you go on the website, you can find a broker for small business, for individual and family. There's an online chat. There's a hotline that's Monday through Friday from 8 a.m. till 5 p.m. that you can call, and they can answer all your questions as well. So if you want to get more specific with everything, the best way to start is to call a broker.
Yeah.
And the number for the hotline was 1-833-862-3935. Again, that's 1-833-862-3935.
Yeah, and I know they'll even visit with you personally, so you can set up a meeting with some of them. So that makes it handy. a lot of different ways.
Absolutely.
Maybe a little harder right now under COVID, but it's a
Well,
possibility that you could meet
yeah,
in
well, Carl, I
person.
did actually want to make that point. Nearly all of our brokers are virtual. So if you're out there, you're a little bit further away from, a town or a city that has an insurance agent, anything like that, you can connect through many of the brokers, either through the phone or through email or through Zoom, like we're doing right now. A lot of brokers have taken training on figuring out how to do that, and they'll find a way to get, in contact with you. The best part about their services, so they're fast, convenient. Like I said, they're local also, so there's a broker in nearly every single county, but they're completely free. So getting that information, learning what's going to be right for you, getting a quote, getting all of that stuff that, teaching you from point A to point B what you need to do to get covered, that's all completely free. They're here just to help you out and make sure that you kind of have the answers to your questions. And how do I get covered? Where do I go? What's my best option? If this is going on in my life, but it's going to change in a couple of months, am I going to want to go with plan A or go with plan B? They can really help with those decisions. So again, talking to a broker and letting them know about your specific situation is the best way to get started.
Um, what carriers have you got available in the small business exchange? And I know the landscape has changed a little bit recently in the last couple of years. Tell us who the carriers are and a little bit about them.
Yeah, so right now through the Small Business Exchange, we have 3 carriers. We have Presbyterian HMO, Presbyterian PPO, and True Health New Mexico. So kind of just breaking that down, because that sounds like a lot of acronyms there. There's kind of some key differences. So the differences between HMO, which is a health maintenance organization, and a PPO, which is a preferred provider organization, include network size, availability to see specialists, costs, out-of-pocket costs, and out-of-network coverage. So kind of compared to PPOs, HMOs typically cost a little bit less. However, PPOs, that's a preferred provider organization, they generally offer flexibility in seeing specialists and kind of have larger networks than HMOs typically, meaning that if you're traveling across state lines pretty frequently, a PPO might be the right might be the right way to go for you. Whereas, if you're in town, you're maybe not going all over the place, you're just getting a checkup every now and again, the HMO might be the best option for you. HMOs might have some good out-of-network coverage. It just depends on what the right fit for you is going to be. So again, that's where we recommend folks talk to brokers, talk to agents, figure out what's going to be just the perfect situation for you, because they are different and they do cover different things.
Yeah, a lot of us in eastern New Mexico end up getting health care across state lines, so that option might be the better one, is what
Yep.
you're saying.
Again, they might want to talk to their agent or broker about PPO, which will, give them a little bit larger out-of-network opportunities. It won't, cost as much typically to do that. So again, talk to an agent or broker. Go to BeWellNM.com, folks. For anyone listening at home, that will give you the best option to search for a broker, either through the individual or the business exchange. That can kind of help you get started there.
Yeah. Are there many options that are, or are the folks limited to the plans that are the plan options that, what are they? In other words, are there a
Yeah,
lot
no,
of
that's
them,
that.
or,
We get that question all the time, Carl. So yeah,
are
there
we
are a
not just
lot
going to
of
be stuck with one?
Yeah, no, there's a lot of options out there. So that's what we're talking about. It's important to talk to a broker. There's 23 different plans and 4 different metal levels. That's a lot of choice. That's more choice than we've had in the market, essentially ever. The most number of plans. There's a lot to navigate there. So that's why we definitely recommend talking to an agent, talking to a broker, so that way you can kind of figure out what's going to be right for you. Because an HMO silver plan might be different than a PPO bronze plan. Both in cost and benefits, and kind of juggling what's going to be right for your business, for your family, for yourself, that can be a lot. So definitely talking to a broker is the best way to do it. But as far as all of the plans go, like I said, there's 23 different plans and 4 different metal levels. So there's more flexibility for businesses than ever before. You've got gold, silver, platinum, and bronze, and those are the 4 metal levels. And it's all the same great coverage. They all cover the 10 essential health benefits mandated by law. You know, a few of those are prescription drugs, ambulatory care, newborn care, rehabilitative services, etc. So those 10 health benefits are all covered under every plan. The only difference is the premium that you're going to pay per month versus out-of-pocket cost when you use the service. So that's really the main difference, but there's a lot of different options. Like I said, 23 different plans with 4 different metal levels in each one. So really being able to go through all those different plans with an agent or broker is going to be key. They can kind of break down the nuances of each one and make sure you're picking the right one for your situation.
Now, when a business opts in, do they choose a metal program for their entire operation? Is that the way I'm still?
Yeah, that's another just phenomenal question, Carl. So essentially the business can pick, you know, say a general silver plan through an HMO, but if their employee actually needs a little bit more coverage, like they're going to go to the doctor more frequently, they can opt in and get a gold or a platinum plan, and vice versa. If they feel like they're not going to be going to the doctor very often, they could opt out and go to a bronze plan at no extra cost to the business. So the business decides how much they're going to contribute for every employee. And, you know, the rules have changed. So for 2020, you can actually provide a different amount for different employees. So say you've had somebody working for you for 25 years. They've been giving you great loyal service. They've been there when you needed them. You can reward them by taking care of a little bit more of their premium than say somebody that started just a few months ago. You know, there is a lot of flexibility, like I said. So a business, you know, might just pick a basic plan. And that can come at low to no cost to the business itself, and at no extra cost to the business. Their employee who maybe needs a little bit more or a little bit less care, they can, you know, choose their metal level within that plan bracket at no extra cost to the business.
What are my benefits for if I, as a business owner, for offering health insurance through BeWellNM Mexico as opposed to going out and doing it on my own or whatever? What's the
Yeah, so there's a lot of different benefits for you. I would say the main one, first and foremost, is tax benefits. So, as a small business owner, if you go through BeWellNM, again, BeWellNM is the only insurance carrier that will give you tax benefits. You can get up to 50% of your contributions tax in tax rebates back to your business. So say, you know, you're spending $1,000 on, you know, your employees' premiums, you could get 500 of those dollars back, just depending if you meet a few qualifiers. So again, you're going to want to talk to a broker about the specifics of the tax rebate, but that's the number one thing. You know, some of the other benefits that come along with offering health insurance, your employees are going to be happier. They're going to feel taken care of. You know, a lot of times employees, they don't quit the job, they quit the manager. And if they don't feel like you have their back, then there's not really going to be that dynamic, that chemistry, that synergy that you need to really, you know, optimize efficiency and, you know, be at 100%. So just having your employees back with a health plan, they're going to miss fewer days at work, so higher productivity, stronger bottom line. A lot of folks feel like, you know, they're paying these insurance plans, but it's kind of just throwing money away. Don't feel like that. You're investing in the health of your employees and investing in the health of your business. That's the one thing I want to get across to folks, is that a healthy employee, a healthy staff makes a healthy business, truly. There are a few businesses out there that you can do without people. So really keeping your staff happy, healthy, and, you know, having their back, that's going to be big. And through the long term, that's really going to show up on the balance sheet there.
Ansel, when is the open enrollment period, and does that matter? Is it just for individuals that need to be aware of that, or does it matter for the businesses?
Yeah, well, I'm really glad you asked that question, Carl. So open enrollment is coming up pretty quick. It's starting November 1st and extends through December 15th. So it's a 45-day period at the end of the year where folks who don't have a health plan or need to pick a new one can do so. So if you're, you know, an individual or a family, you have to wait until that open enrollment period in order to sign up, unless you've had a special enrollment case, which would be, you know, either you've gotten married, you've been divorced, had a kid, got a new job, lost income, etc. That's when you could, you know, apply throughout the year. But typically folks are going to be waiting until that open enrollment period at the end of the year. Now, Businesses do not have to abide by this open enrollment period. They're throughout the year. They're a continuous enrollment period. So say a business signs up in January or February, all the way through September, if they're hiring or letting people go, etc., they can bring people in and have them join the insurance plan as soon as they're ready to. It's not something where they have to wait to join their insurance plan. Small businesses can enroll their employees year-round, whereas individuals and families will probably have to wait until the special enrollment period, November 1st to December 15th.
Okay. And finally, I guess, what's the best way to get in touch with BeWellNM New Mexico, and you need to talk to Ansel in person? Is that a possibility?
Absolutely. So the best way to reach BeWellNM is through our website, BeWellNM.com. That's BeWellNM.com. You can reach us through our hotline, which is Monday through Friday, 8 a.m. through 5 p.m. at 1-833-862-3935. Again, that's 1-833-862-3935. You can also reach me on my personal cell phone at 505-307-1937 or Ansel@waitcompany.com. I'm available through call, text, or email day or night. So folks, if you have any questions, please get in touch with me. I'm happy to let you know what your options are, get you connected to an agent or broker in your area, and help you, wade through this, because I know there's a lot of information and a lot of folks get discouraged. They don't know what their options are. They feel like there's no help out there. I just want to let you folks know we are here for you. I'm here for you. We're going to help you get through this. We're going to help you find the best choice for you. There are options out there for you. Okay.
Yeah, and I just might add that you can get the link to the various brokers on your website, and those folks are invaluable. I went that route myself, and I would urge people. Ansel's nice to talk to, but you can also talk to somebody local that can help you along.
And that truly is the best way to get in touch with an agent or broker, is to go through our broker search tool on our website at BeWellNM.com. Go to the quick Find a Broker tab. And like I said, there's one in nearly every county. They're quick. They're completely free. They make things easy. So like Carl said right there, testimony, they make things really easy. They take the complex information, break it down into understandable bite-sized chunks, and let you make your own decision. So it truly is invaluable. But Carl, I just wanted to say thank you for having us on today. I really appreciate this time that you set aside for us. So I want to say thank you from BeWellNM to you guys at the Roosevelt County Chamber. We want to say thank you. We're proud members, and we can't wait to get out there, start doing more seminars, and get in touch with the community more face-to-face as opposed to through a Zoom call. But I really appreciate you. Thank you so much for taking this time and allowing me to get this message out there.
All right. Stay safe, Ansel.
Yeah. Stay safe. Stay healthy. Thank you so much, Carl. Appreciate you. Bye, Roosevelt County. Thank you so much for your time. Look forward to seeing you.
All right.